Oh. Alrighty. Good afternoon. Welcome to Mobility Wall Mondays. I'm so sorry for the technical difficulties. We had a little Safari Chrome battle going on this morning. I am your mobility coach for today. My name is Dr. Shea Stark. I am a sports chiropractor, and I own Stark Chiropractic and Sports in Houston, Texas. Today, I want to talk to you about low back issues and how we can work on them with the mobility wall. As a chiropractor, so many people come into my office with low back issues. But believe it or not, the vast majority of them don't actually have low back problems. They have pelvic problems or sacral problems, which is the tailbone. And a lot of that comes from muscle compensation in the glutes. And so there's such a huge role that the glutes play when it comes to low back pain. So we're going to focus on a lot of that today. I want to say thank you for everyone who's joining us today. Please add your name, where you're from in the chat, because in the live today, I'm going to be randomly choosing somebody to win a travel bag for your mobility. I'm kind of jealous. I need to get one for myself actually too. I travel a bit treating athletes, and so I definitely want to be traveling with my mobility wall. So please leave any questions or comments in the live chat, and I will address them as we come in, and we'll get going. So the goals for my video today, for what we're going to be learning, is we're going to focus on that lumbopelvic complex, okay? So how the low back, the lumbosacral fascia, the glutes, and the tensor fascia lata all come together to protect and support your low back and your pelvis, okay? Why does that matter? Okay, we have so many people who are weekend warriors. Okay, they're out doing all kinds of crazy stuff. I have athletes that come in my office training for CrossFit. I have a lot of runners, a lot of jumpers, people who do jumping sports, basketball, volleyball, even some track and field events. And it's really important to make sure that we have stabilization in those glutes so it protects the low back. Okay, that's a really big, important thing. So the first thing I want to do when we get started is to talk to you about how to properly place your mobility wall. The number one thing I see is when people have their mobility wall facing in the wrong direction and they put too much weight into it and they fall. And that's not what we want to have done. So for safety reasons, you want to make sure that your mobility wall is placed in the door, and any pressure you put into your mobility wall, you want to make sure it's in the direction of those L brackets, okay? So that's the number one thing. Safety first, always, okay? And to get started today, what I want you to do is I want you to place your mobility wall in right above the hip bone, okay? So when you kind of feel the top of your pelvis here, that's where we want you to start with your mobility wall. Now today I'll be using the Mobility Wall Pro Series. I think this works really, really well with our athletes and anybody who has significant trigger points. Now, of course, if this is a little bit too high pressure for you, you can definitely switch over to the Smooth Mobility Wall Series. And so what we're going to do to get started first, the first area we're going to focus on is the lower back, okay? So you've got a lot of stuff going on in that low back, right? You have your lumbar paraspinals, your erectors, okay? You have your quadratus lumborum, which are the square muscles on the sides of your back. And then you have your lumbosacral fascia. Now, we can't forget about that because the lumbosacral fascia is so important to the movement and glide of your muscles on each other, okay? It's a fairly fibrotic piece of fascia, similar to your plantar fascia or your IT band. And so you're never going to be able to get it to loosen up. It is not a contractile structure. but rolling over that lumbosacral fascia can really help to loosen up the muscles around it, okay? If you don't know what fascia is like a spider webby type substance that is literally ingrained throughout your entire body. If you were to take every piece or every type of tissue, out of your body, bone, muscle, organ, nerve, skin, and only left your fascia, you'd still have a 3D model of your body. That's how entwined fascia is into your system. So it's really important to make sure you understand what it is, where it is, the types of fascia you have in your body, and what you're actually working on. So I try to explain to my patients this way. Fascia is like coconut oil, okay? It's like that consistency. When it's cold, it's hard, right? Like when you have coconut oil that's room temperature, it's a solid. And then as you start to warm it up, it starts to emulsify and you get that more liquidy, more mobile substance. That's how fascia is. That's why it's always really important to make sure you warm up properly before you start to do any sort of stretching or myofascial release. Otherwise, you're just kind of stretching the fascia. You're not really manipulating it at all. And so making sure that you've got a good blood flow going and you're nice and warmed up, it's going to make the self-myofascial release process so much easier, okay? Now, before we get started with the low back, there's one thing that I wanted to make sure I touched on with everybody, and that's the difference in what sets Mobility Wall apart from other myofascial release tools like a foam roller, right? So I love Mobility Wall, and my patients love Mobility Wall because it gives you the opportunity to perform self-myofascial release in 3 dimensions versus a foam roller, whether you're using it on the floor or up against a wall, you still have something that's limiting your movement. And so Mobility Wall, I can literally use it in all dimensions, right? And the other thing that's really important to understand is that providing tension or pressure in a downward motion, similar to what you would use with a foam roller, is not the most ideal way. It's painful. If you've ever tried to foam roll, it's super painful. It's hard to control the amount of pressure of your body weight that you're putting into the tissue. And so that's why I love the Mobility Wall so much, is that the inward and upward pressure that you're able to apply into that is so much more effective than that downward pressure you're putting into a foam roller. Not to mention that you get to control how much pressure and how much body weight you're putting into that Mobility Wall. Okay, so that's one of my favorite things about it. So keep that in mind and kind of watch how that's going to be incorporated into what we're going to do today. All right. So let's get started on that low back, okay? So the first thing we're gonna do is the lumbar paraspinals, okay? And how we do that is you're gonna back up into your Mobility Wall, and you wanna make sure that where you have the trigger point attachment right in the middle, that's gonna kind of be where you wanna put your spine, okay? So you wanna make sure that you line yourself up on the Mobility Wall where your spine is right in between the rollers, okay? That way we're not having any sort of pain or tension put into the spine area because that's not very comfortable, okay? So what you're gonna do is you're gonna stand with your feet a little bit in front, and you're gonna kind of lean into the Mobility Wall. You don't necessarily wanna stand straight up into it because then you're not gonna get as much movement, right? We want that inward pressure to the Mobility Wall. So I want you to step your feet out about half a foot length in front, okay? So you're kind of at a little bit of an angle. And what we're gonna do here, you wanna make sure that your feet are set beyond shoulder width because you want a strong base. And we're gonna work into a little bit of squatting as we're putting that the pressure inward on the Mobility Wall. So you're gonna kind of set yourself up to squat a little bit, and you're just gonna roll nice and slow up and down that Mobility Wall. And what you're getting there is you're getting those lumbar paraspinals, okay? So just nice and slow, okay? You don't want it to be significantly painful, okay? It should be fairly comfortable. You might have a couple sore spots here and there, and you wanna make sure that Mobility Wall is placed where you are still getting into the sacroiliac joints right at the base of your spine, okay? Those ligaments are so important to get worked out. And that's a huge part also with that lumbosacral fascia. Okay, it's all interconnected. So you just want to make sure you're going in nice and slow into those squats and getting that nice release there. Okay. So now on the next time when you get down into your squat, I want you to hinge and stick your booty in the doorway. Okay. And what you're going to do with that is it allows you to kind of round your back through that lumbar spine. And you can push up just a little bit by straightening your knees a little bit. And you're just gonna push into that lumbosacral fascia. Okay, just nice and slow. And you can kind of roll up and back, because remember that lumbosacral fascia is like a diamond shaped in your low back, okay? It starts at the bottom of your trap, which is at T12, and it kind of wraps out to the ends of your iliac crest and then back into your sacrum, okay, anatomically. So it's a big piece of fascia that you want to make sure that you're working into, okay? Another thing that I really like to do is so if I'm pushing up from the bottom, once I get up to the top, I kind of round my spine a little bit, just flex that lumbar spine and push it right into that fascia, okay? And just do that for me a few times. So we're gonna roll all the way up. Once we get to the bottom, you wanna push up into that foam roller, that upward pressure we were talking about, and then roll up to the standing position and flex your lumbar spine and just press into that foam roll, into that mobility wall, okay? And that really helps to open up that low back, okay? Keeps it mobile, right? A common misconception that I have in my office when people talk to me about low back pain is when I have them do thoracic mobility exercises and they're like, but doc, my mid-back doesn't bother me. And I'm like, well, you have to understand how the body works. There's the theory of regional interdependence, okay? And what that means is every other area of your body is either stable or mobile, right? So your mid-back, believe it or not, should be mobile, and your neck and your mid-back should be stable. And a lot of times I see patients who come in my office with low back pain, and I have them work on that middle back area, and their back pain goes away. And they're like, but doc, you didn't even touch my low back this time. And I said, well, I don't have to, because that's not necessarily where the problem's coming from. So making sure that you're working on the mobility of your mid-back to re-stabilize the low back is so important, okay? So that's the big thing that you want to work on. Now, the next area into that low back before we move this mobility wall down a little bit is the QL, the quadratus lumborum, okay? Those are the square muscles that come from the middle of your spine and out to your iliac crest, okay? And they're on both sides. Now, these are how you laterally flex, okay? So you want to make sure that you are, it's almost like a pin and stretch into that QL, okay? So you want to get sideways into your mobility wall, perpendicular to it. So it's still at that hip height. You want to squat down just a little bit to where the mobility wall hits you right in that little curve of your waist, okay? And then from here, you're going to rotate obliquely away from the mobility wall so that you're locking that QL in with the mobility wall, okay? So here you can just kind of press inward into that mobility wall to loosen up that QL just a little bit, okay? And just hold that 10, 30 seconds maximum, depending on how you feel. Get a nice little workout in the quads as you have like a good little squat here. And once you've released that pressure, you can come back out of it, okay, just to loosen it up a little bit, shake it out. And then you're going to get right back into that same position. So squat down a little bit, press into that mobility wall, and then turn obliquely away. You're going to take that same hand that's on the mobility wall, and you're going to stretch and pull over, giving yourself a nice little pin and stretch. Hold for about 3 to 5 seconds, come back up, and then we're going to repeat that a couple times. And that's going to open up that QL a little bit. And you can always reposition where you're at to get different areas of that QL as you go to stretch. Okay, and you can rotate your body as well to get the optimum pin and stretch to that muscle, okay? So we're gonna do the other side. It's always important to do both sides. That's one thing I always try to impart in my patients is that if you have right-sided low back pain, it is always, always, always so imperative to make sure that you're also doing the left side, all of your stretches, all of your exercises, all of your myofascial release. Because if you don't, you could create a compensation issue from one side to the other. I can't tell you how many times I have people come in my office with right-sided SI pain, and the dysfunction is actually on the left side. And it's because the left side is just so tired of doing all the work that now it's making the right side do all the work, and now we have pain, okay? So let's go ahead and settle into that left side. So we're gonna squat down just a little bit, align that mobility wall into the curve of your waist, rotate obliquely away, and just press into that mobility wall. Good. And this is the greatest thing about it is you get to control how much pressure you put into it based on how it feels. If it's more than a 2 or a 3 on a pain scale out of 10, then you need to back off on how much pressure you're putting into it. Contrary to popular belief, myofascial release should not be painful when you do it on yourself, okay? Otherwise, you're just irritating those tissues, and we don't want that to happen, okay? So again, we're gonna come out of that, shake it out just a little bit, get that tissue moving, and then we're gonna reposition, set oblique, and then stretch to open up that QL. Rotate a little bit to get extra areas. And hold, and repeat that a couple more times at your pace to make sure that you're working those areas, okay? All righty, just checking in on some of the comments. Great, thank you so much, Dave, for your compliment, appreciate it. All righty, and yes, I agree with Chris that the pain point is not always where you feel it. If you're going in to see a provider, a massage therapist, a chiropractor, a physical therapist, and you tell them it hurts right here, and all they do is mess right there, go see someone else, okay? I promise you, they don't know. They're not looking for the other areas. It's so important to make sure that you're not only working the area of pain. That pain is most likely coming from somewhere else, okay? Alrighty, so the next area we're gonna work on, we're gonna move this mobility wall just a little bit, and we're gonna focus on what I think is one of the most important muscles in your body, period. And that's your gluteus medius, okay? I'll call that the glute med from here on out. The glute med is probably the most important hip stabilizer in your body. And if you don't have a strong glute med, you're in trouble. It controls so much. It is the keystone to low back pain. If somebody comes in my office with low back pain, the first place I touch is their glute meds, and most of them jump off my table, okay? The important thing about the glute med is that it stabilizes your pelvis when you're on one leg, okay? So if you're standing on one leg, it allows your pelvis to stay neutral instead of dropping it, okay? Why is that important? Because most of us walk on 2 legs, okay? So what that means is as we're walking, we're always only on one leg. And so that's really important to make sure that that glute med is firing appropriately so it supports your pelvis, supports your low back, and make sure that everything's moving the way it's supposed to, okay? So there is always a direct connection between the sacroiliac joint, okay, and the gluteus medius. And if you're not seeing that, you're missing the boat on when it comes to low back pain, okay? So what we're gonna do is we're gonna drop that mobility wall just below the hip bones, okay? So we're just gonna loosen those. We're gonna tighten it back up. And so you wanna be just right at that greater trochanter of the femur, okay? It's a little lower than your glute med, but that's okay because we always want to get down and into the mobility wall, okay? So the glute med is located just oblique, okay? It's not quite right on your side. That's another muscle we'll get to in just a second. So if we go directly down the side of your iliac crest, okay, that's your hip bone, your pelvis, and we go just behind it off to the side, that is your gluteus medius. And if you poke around in there, most of the time you're like, ow, okay, that's really painful, okay? Because this muscle gets used so much, it's imperative that you're rolling it, okay? And it's such a small muscle that it's really difficult to get with a foam roller on the floor because the surface area is so large, okay? That's why I love my Mobility Wall Pro, because the little knobs in the roller make it so easy to pinpoint that small muscle, okay? So what we want to do here is you want to kind of back up at an angle into your mobility wall. So you want to be facing about 45 degrees into your mobility wall, okay? So if we're standing parallel, turn about 45 degrees, and you're going to work that back muscle into that mobility wall. So you squat down just a little bit with that back leg until you're resting into giving inward pressure into that glute med, okay? And so again, we're just going to press into that for a little while. A little stiff, a little sore in there, a little bit tender. And you're just pressing just a little bit into that. You can even slowly start to kind of hike and drop your hip a little bit to roll through that glute med, because it is oriented a little bit vertically in the glute, okay? So just rolling up and down until you feel it. And once you get that movement, you're gonna start to feel all of those little trigger points that are in there, all of those tender spots. And so you just find those areas and press into them for about 30 seconds, okay? And again, you're controlling that pressure. It should not be excruciatingly painful. If it's above a 2 out of 3, or 2 or a 3 on a pain scale, you're pushing too hard, okay? So keep finding those spots and just pressing into them just a little bit. And you can even give it a little cross friction, just rocking that hip up and back to work out some of that tension in the glute med, okay? Awesome. And just keep finding those areas that are really tight on you, okay? Whew. Now, the glute med attaches into that greater trochanter of the femur. So a lot of times what I find is that tendinous attachment is what's really flared up. You're almost getting a gluteal tendinitis. Or if it's been there a while, a tendinosis, right? And so you want to make sure that you're going all the way out to that greater trochanter. That's the most tender spot on me. I move around a lot, obviously, in my job, and I manhandle people on my table on a daily basis. And so I always have to make sure that my hips are rolled out, my glutes are strong and stable, because I don't want to hurt myself or anyone else when I'm working on them. All right, let's switch to that other side. So again, we're going to start parallel. We're going to start parallel to the mobility wall, and we're just going to rotate 45 degrees obliquely and kind of push into that glute. Again, just find that tender spot, hold that pressure for a few seconds. Good. Rolling up and down to find those spots that are really tight, really tender. See, on my left side, it's a little bit more medial. It's closer to my tailbone, where I'm starting to feel that really tender spot versus out on the tendon here. Again, we're just gonna kind of rock back and forth, going through that whole insertion, origin to insertion on that muscle, from the iliac crest down to the greater trochanter, and just rocking all the way up and down until you find, a good spot. It's a good spot for me right there. I empathize. I feel your pain for those of you following along with me. That's why it's so important to make sure that we're rolling those glutes, because they are so important in that lumbopelvic complex, okay? Yes, Chris is completely correct. When you're able to be on your feet and you have full control of your movement as you go to the different areas of the trigger points and the different areas of tenderness, it's so important to do that. That's another reason I love the mobility wall, It gives you so much more control, okay? Don't forget, we're giving away a travel bag today at the end of the live. So if you haven't already, add your name, where you're from, a question, a comment in the chat. That way I have a little bit more people to choose from. I know Allison got lucky last week and won her bag, so we're going to keep up with her already. So the next area we're going to work on is your TFL, okay? If you don't know what that means, that's your tensor fascia lata, okay? It's a very small muscle right on the side of the hip. Why is that important? Because that muscle aids the gluteus medius and abduction of the hip. It's also the small muscle that's incorporated within your IT band. I have so many people, runners, CrossFitters, young athletes that come in and they're just like, Doc, I've been foam rolling my IT band and it's just not helping. I'm so tight, my hips are tight. And I ask them to demonstrate for me. What are they doing with that foam roller? And they're going all the way down the lateral leg, all the way from greater trochanter to the knee. And I tell them, I'm like, well, of course it's not helping. You're basically trying to foam roll a non-contractile tissue. It's not going to do anything except hurt like crazy, okay? So I try to instruct them. Foam rolling the IT band is important if you know how to do it correctly. And there's 3 ways that you should be foam rolling that IT band or mobility walling the IT band, and I'll show you that here in just a second. The first one is not to go directly over the IT band itself. That fibrotic tissue will never change. It's not supposed to, okay? It is a fibrotic tissue for that specific reason. Yes, Daryl, hamstring for sure, and I'll get to that in 1 second because there's an important reason to do the hamstring. Is to go obliquely off the IT band, okay? So that IT band runs right between the quad, the vastus lateralis, and that hamstring, okay? That's the bicep femoris, okay? So the 2 ways that you foam roll the IT band down past that greater trochanter is obliquely in the connection between the IT band and the muscle next to it. Not directly over the IT band, but you want to go right in that crease between the vastus lateralis and the IT band, or between that biceps femoris and the IT band, okay? That's the trick. It's so important because if you just keep crushing that IT band, you're just going to hate life because it's so uncomfortable and you're going to bruise to high heaven and it's not going to change anything. Now, the third and most important one that I tell people when it comes to foam rolling or self-myofascial release with the IT band is getting that tensor fascia lata, which is that really small muscle that comes right off the hip bone, right underneath it, just into that, just above that greater trochanter. Okay, so if you kind of push into that, you'll feel it. It's not comfortable. So that works in concert with the gluteus medius to abduct the hip and stabilize the pelvis. Okay, so how we're going to get into that is we're going to give inward pressure into that mobility wall, and then we're going to pin and stretch that TFL. Okay, the TFL, like the peroneals on the side of the calf, or the side of the lower leg, are not easy to stretch, right? Because you have to be very, very flexible and it's not exactly safe. Because to get that TFL, you kind of have to hike the hip and then rotate down, but you're kind of just really stretching in through the glutes that attach the greater trochanter. You're not really stabilizing, you're not really singling out that TFL. So using the mobility wall gives us that opportunity, okay? So what we're gonna do here is we're going to get directly perpendicular to that mobility wall, okay? We're going to squat down just a little bit to give you that control, okay? We're going to press inward into that mobility wall, right perpendicular, right underneath that iliac crest. Woo! That is tight, that is tender, okay? So manage how much pressure you're putting into that. And what you're going to do again, similar to how we stretch with that QL, the pin and stretch, is you're going to take that inside hand and you're going to bring it up over the head and reach and stretch over as we're pressing inward into that mobility wall. okay? So you want to push in and then stretch over. And you're going to feel a nice stretch along those obliques on the other side here. So you're stretching in through those obliques, through the lat, but you're catching that TFL because you're pinning it with the mobility wall, okay? So we're going to just do nice hold stretch 3 to 5 seconds and then come on down and repeat that several times until you start to feel some of that tenderness go away. And again, you can change the angle and the point of pressure that you're putting into the mobility wall to get all the different aspects of the TFL. I get it a lot if I rotate into the mobility wall a little bit and I'm getting that front edge of the TFL. That fascial connection is really important as well, okay? So we're gonna do that a few times and then we're gonna switch into the other side. So we're gonna go perpendicular into that mobility wall, squat down just a little bit to give you a little bit of control. Pin, if you're using the Pro Series, pin in with one of the little knobs, and then we're gonna push up and over. Ooh, yeah, that feels great. That feels awesome. How many of you watching right now are actually doing this with me? If you are feeling my pain, and I empathize with you, but when I tell you, you're gonna feel so much less pain, pressure, tension in that lumbar spine, in that low back, in that pelvis, it is so worth it, so worth it. So keep that in mind when you're working through the glute med. You also want to come around to the side and catch the TFL. It's a very easily forgotten muscle, but it's so important, okay? When your patients, your clients come in to see you and they talk about foam rolling that IT band, give them a better option. It's not helping, okay? And then finally, the area we're going to work on is the piriformis. If you don't know what the piriformis is a deep, small muscle in the thick of the buttocks, all the way down past the glute max, past the glute med, past the glute min, all the way. Randy, I'm glad you're feeling it too. So Daryl, what you're talking about, a shoulder pinch when the arm goes up over the doorway, that would be something to roll out into the scapula, the posterior rotator cuff, the rhomboid between the scapula, all of that stuff, that thoracic mobility that we were speaking about before. That would be really important to do prior to doing any sort of low back or pelvic issue work, because you need to have that mobility in the thoracic spine in order to fully get the best out of the low back exercises, okay? Alrighty, maybe that'll be my next one, is to work on some thoracic mobility issues, okay? So the piriformis is a very small muscle, okay? Deep, deep, deep in the butt. It is a muscle that has a direct relationship with the sciatic nerve. When I was in chiropractic school, one of my instructors would always, every time the word sciatica came up, he would always say cha-ching, because he knew that was one of the most common reasons people go see a chiropractor, is because of that sciatic nerve. So if you don't understand the connections to the sciatic nerve, what is not sciatica, do your homework, because it's so important, okay? So the different correlations between the piriformis, so sorry, Bob, my IT band hates me too, but you'll definitely love it tomorrow, absolutely. So the three different relationships that the piriformis has with the sciatic nerve are these. Either the piriformis goes beneath the sciatic nerve, or it could go above the sciatic nerve, or worst case scenario, the sciatic nerve pierces the piriformis and lives there forever. Now, those people typically have chronic sciatica known as piriformis syndrome, okay? There's no real way to know, okay? That's a very small percentage of people who have that, but the only way to really know that is to get an MRI, and it doesn't really matter, right? It's not gonna change your course of treatment. It's just, unfortunately, those people are gonna have chronic sciatica, and there's not a whole lot we can do about it, okay? So just understand that piriformis, the most important thing to take away from that is the piriformis has a direct connection to the sciatic nerve. So if you're missing the piriformis when it comes to soft tissue treatments, you're missing the boat on low back pain or potentially radicular issues down the legs, okay? So the piriformis performs external rotation of the hip, okay? So how many times when you're walking, when you're sitting down, are you externally rotating that hip, right? Bringing that hip out. One good thing to notice is that if you have a patient who comes in or a client who comes in with low back pain, watch them walk. If they walk with their toes pointed out, most likely they have tight piriformis. That's a telltale sign of tight piriformis, and you need to get in there, okay? I used to be a big proponent of giving the piriformis patients the people's elbow, because that's what they would need. It was the only thing I could do that would get deep enough past the glute max, past the glute med, into that piriformis to actually loosen it up. But it's not fun. It's not comfortable. The patient cannot control the amount of pressure you put into their body, and so they don't like it. So that's one of the things I really love about the mobility wall is the patient gets to decide how much pressure. They get to make that decision. And so this is when I'm going to bring in my trusty trigger point tool, okay? The trigger point attachment. It's a small ball attachment that goes into the mobility wall. So, of course, when you're adding that trigger point attachment, for safety, you want to make sure you're locking that ring, okay? So you want to bring it all the way in, make sure you're lining it up, and then locking that ring into place, okay, so that you're not chasing the trigger point attachment all the way around the mobility wall, okay? So you want to make sure that you're unlocking the cam lock, you're putting your trigger point attachment in, lock that cam lock into place, and now we're set to go for that piriformis, okay? So we should be in a pretty good place with where the mobility wall is at right now to get you right into that piriformis, okay? If you need to move the trigger point up or down just a little bit to get deeper into that glute, that's what you want to do, okay? So when we get into that, when we have that trigger point piece set up, we're going to lean. You want to go right into the center of the buttock, okay? That's where you're going to find the trigger point to the piriformis. That is the body of the piriformis, the belly of that muscle, okay? So you just want to lean into that. Again, control how much pressure, how much inward push you're getting into that trigger point. You can kind of bend that left knee. I'm working on my right glute, so you want to bend that opposite leg and push in a little bit more, keeping that right leg that I'm working on straight and just leaning into it. And then again, you find along that piriformis. Now understand that piriformis is a lateral muscle, okay? So it goes from the sacrum to that greater tuberosity of the femur. So you want to make sure that you start in and work your way out. Woo! Found it. Has anyone found it? You found that piriformis? If you are working into that trigger point and you start to feel sciatic pain down the leg, numbness, tingling, that's normal. That's that direct connection to that sciatic nerve, okay? If you keep working it, you will feel less and less of those radicular symptoms. That is normal. Woo! Again, I'm starting to feel mine more towards the tendinous attachment to that greater trochanter. So the more I go lateral, the more pain I get into that piriformis. All right, so once you've worked the length or the width of that muscle, we're gonna go and do it on the left side. Okay, again, keeping that left leg straight, we're gonna bend that right leg, woo, just a little bit. You wanna keep that left leg, the affected leg that you're working on straight, because it deloads that piriformis. If you keep that knee bent, you're having to stabilize the pelvis with that leg, and you're not able to get deep enough into that piriformis because the glute max and the glute med are stopping you because they're firing. So make sure that you're keeping that the leg you're working on straight so that you're not activating those muscles. And we're just slowly working our way all the way lateral towards that greater trochanter. And you'll always have one side, for whatever reason, there's always one side that's more painful than the other side. And it's usually my left, because I'm typically affected on my right side. I have chronic SI issues on my right side. So my left side always works extra hard, okay? All right, so once we go through the trigger point to that piriformis, the next thing we're gonna do is we're gonna get to that most tender spot that found during that exploratory phase of the piriformis. And what we're gonna do here is we're gonna bring that knee up just a little bit. We're gonna bend it so that knee is up off the floor, and we're gonna externally rotate the hip and then internally rotate the hip. Good. Let me adjust my camera so you can see exactly what I'm doing here. So we're pressing into that. We're lifting external, internal rotation. Just nice and slow. You want to make sure you're going controlled to the point where you're going full range of motion. Okay, you shouldn't be running fast. It shouldn't look like this. That's just going to be really uncomfortable. So go nice and slow. Go all the way, into full external rotation, and then stretch it all the way into internal rotation. If you need to keep that leg straight for any reason, that's totally fine. You can still work that internal and external rotation of the leg, okay? Perfect. So now we're gonna switch that to the other side. We're gonna get into that left piriformis. Good, we're gonna bend, externally and internally rotate that hip. Good. I always try to encourage my patients to stay in an area, if you're on one trigger point or one tender spot, is to work that for no more than 30 seconds to a minute, and then work that entire area for about 2 to 3 minutes, okay? So that you're not spending so much time in one spot that you're gonna start bruising or damaging that tissue, okay? There is a thing called over-treating, okay? If you're spending 5, 8, 10 minutes in one muscle, you are going to anger it immensely, and then you're gonna be in more pain than you were in before, okay? So small doses of myofascial release, okay? If you're doing 2 to 3 minutes at a time on one glute, you can do that repeatedly every day or every other day, depending on how your muscles are repairing, to make sure that you're able to continue with your treatment. Because if you do it too much and it hurts, you're not going to want to do it anymore. Okay, so utilize that mobility wall to your advantage. Okay. Yes, absolutely, Chris. Being able to mobilize your joints and incorporate range of motion techniques, greatest benefit of mobility wall. I love it for that reason. I am not getting restricted by a wall or by the floor when I'm trying to internally and externally rotate. When I bend my knee is in the doorway. If I was using a foam roller against the wall or a foam roller on the floor, I wouldn't be able to allow that full range of motion. Do you have, Randy, do you have that lock ring in on one of your sides? You're gonna have a lock ring that's able to stabilize that bar so it doesn't rotate when you're using the trigger point piece. So you wanna make sure that that lock ring is engaged all the way in, because now you're no longer getting movement from the wall or from the mobility wall, okay? All right, so that is it for me as far as what I've got to show you guys today. Thank you so much for tuning in. If you have any questions, comments, please place them in the chat. I'd love to interact with you guys a little bit more before we call it quits today. Also, don't forget we're going to be choosing a winner today for the travel bag for the mobility wall. Again, I'm super jealous. Chris, you want me to work on some hamstring work? All right, I can do some hamstring stuff. I wasn't going to do it, but I'll do it for you. So the hamstrings are really important to work on with the lumbopelvic complex because the hamstrings attach, they originate. Oh, Daryl asked. Thank you, Daryl. The hamstrings do attach to the ischial tuberosity, which is your sit bone at the base of your pelvis. So it is really important to make sure that you are incorporating that hamstring when you're working through the lumbopelvic complex. I just didn't want to run out of time. So there's a few different ways that we can work the hamstring when it comes to the mobility wall. One of my favorites is to kind of come up and over that the mobility wall a little bit. What I'm going to focus on more is the origin of the hamstring because that is really difficult to stretch. And a lot of times if you have that high hamstring strain, you can't stretch it to save your life because the lower parts of your hamstring are so tight, okay? So what I actually do, I'm going to take my trigger point attachment out. I'm going to unlock my locking ring here so I get a little bit more mobility with that wall. And we're going to bring this down just a little bit. Good. Just below that greater trochanter. Because what we're going to do is you want it to sit. I'm going to lower that just a little bit because I don't want to be on my tiptoes. Good. So again, you want to be able to put that inward pressure into the hamstring. So when you step up against it, that mobility wall should be right underneath the crease of your buttocks, okay? All right, so what we're going to do is we're going to sit into, you kind of want to get it right underneath your glutes, and you're going to sit into it. You're just going to put that inward pressure, okay? That way we're not having to deal with that downward pressure. That's not as effective. We want that inward pressure. And so what you can do here is we'll do one leg at a time, okay? So we'll get that right leg, keep that right leg straight. We're going to bend that left leg into a lunge position, and we're just going to roll back and forth into that high hamstring. So what you're really doing is just kind of pressing into, and you're working from about here to here, just through that crease of the butt, and just pressing into that. Okay, and what you're doing with that down leg is you're going almost like a little calf raise. Okay, so that off leg is bent, the affected leg that we're using is straight, and we're going calf up, calf down, and just pressing into that mobility wall to get that high hamstring at the pelvic attachment. So you can do 10 to 15 of these, going through full calf range of motion, full ankle range of motion, and then we'll switch sides. Doing the same thing on the other side. Good. How's that doing? There we go. And just working that hamstring. Oh yeah. See, left side, I got a good trigger point right in that crease, right where that origin of the hamstring is. And I'm kind of using my mobility wall as a stability, and I can kind of press in or pull up just a little bit on it to counterweight what I'm doing inward into the mobility wall. So again, a good 10 to 15 reps on each side will catch that high hamstring that attaches to the pelvis. Awesome. All right. So thank you guys so much. I love this. You threw me a curveball there at the end, keeping me on my toes. It's a good way to show I know what I'm talking about and not just reading out of a book. Okay. All right. So I'd love to go ahead and choose our winner for today. If you have any last minute questions or comments, please post them. I don't want to miss anybody. Awesome. Thank you so much, Matt. I appreciate you. I was really nervous about doing this today. I was kind of pacing my office beforehand, but it was a lot of fun. So thank you guys so much for being engaged with me and for communicating with me through the live chat. I think I'm going to have to say my winner for today is going to be Daryl Davis. Thank you so much. You kept me on my toes and had me throw in something at the last minute to do my hamstring stuff. Hi, Elise. Get that mobility wall out of the box, girl. Get it going. You're going to love it. So, Daryl, thank you so much for attending today and for being so engaging in the chat. So what you're going to want to do in order to get your travel bag is to email chris@mobilitywall.com, chris@mobilitywall.com, and he will send you your travel bag. I'm jealous. I think I need to go get mine online when I log off with you guys today. Thank you so much again. My name is Dr. Shea Stark, and I appreciate your time. Go out and use your mobility wall. Thank you, everybody. See you next time.